not had a chance to introduce myself. So Rachel King, Deputy Director from Wolverhampton, and I've been leading on the reforms in Wolverhampton since we were chosen as a Wave 1 Pathfinder. So in terms of the how we've built upon it, I think it's quite clear we were chosen for specific reasons. So we'd got a good Ofsted rating at the time we were chosen, with outstanding for leadership. We'd got 8 hubs already locality based across the city. So our family help offer was already on a locality level. We'd got our social workers already co-located with our targeted early help staff. And we were also a family hub authority, so we'd turned our 8 strengthening family hubs into family hubs over the duration of the family hub programme as well. So we were in a really good position to build on some of that practice. We'd already got as well restorative practice as our practice model embedded across the whole of children's services, and we'd just started to do some work with partners around how we rolled that out more broadly across the sort of wider partnership, to make sure that we were all sort of working in the same way with our families in a relationship led way. So the reforms really did allow us to build on that, and in terms of some of the things that we did, our family help space, as I say, we'd already got that co-location, we'd already got co-working relationships between targeted early help and social workers. So we built on that in terms of looking at gaps. So in the early stages of our co-design, we also did quite a detailed needs analysis to look at where our gaps were in provision. So, for example, in Wolverhampton, we identified domestic abuse and targeted youth support as specific gaps in that family help multidisciplinary space. A lot of our repeat referrals, when we looked at them in detail, had got a domestic abuse theme that ran throughout. So we recruited dedicated specialists within that field. So it really allowed us to build on that. And similarly, in the family network side of things, we'd already got an established FGC offer. It was predominantly in that edge of care, more crisis-driven space. So we did do some work to push that down in the system to make sure we could offer it much earlier on, but we were building on rather than starting from scratch, really. So